Welcome to What Alcohol Policies, a community approach to reduce community harms. My name is Kristen Kidd, and I am with the Southeast Prevention Technology Transfer Center. And Liz, you can go on to the next slide. And this is fun because I can't quite remember what the next slide is going to be. So a quick disclaimer for us, the Southeast PTTC. This webinar is being recorded and it will be available on our YouTube page in just a few days. We usually get it up pretty quick. And the webinar is supported 100% by SAMHSA and Health and Human Services. The contents are those of the authors and don't necessarily represent the official views, nor are they endorsed by SAMHSA, HHS, or the U.S. government. And if you have any questions, you can reach the Southeast PTTC at southeast@pttcnetwork.org. Another disclaimer, because we are collaborating with the Center for Advancing Alcohol Science to Practice, their project is supported by the Centers for Disease Control and Prevention. And as part of financial assistance award, 100% is funded by the CDC, and the contents also are those of the authors and don't necessarily represent the official views, nor are they endorsed by the CDC, again, HHS, or the US government. So this, like I said, we're being recorded right now, and at the end of the survey, at the end of the webinar, excuse me, you're going to get a link to complete a survey, which is our evaluation. It's called a GIPRA, and it's what our funder requires, and it's how we find out from you how well we're doing, what you liked about what you heard, and it even asks, I believe, what you would like to hear us train or present on in the future. So please do take a moment to complete that survey. Once you're done with it, you should see a little link at the top where you can click and download your certificate of attendance, which is a PDF that you can customize with your name. So I know those certificates are really important to many of us. Next slide. So the PTTC network uses affirming language. We believe that language matters and words have power, and inclusive language is the recognition that words matter, and word choice can be used to intentionally or unintentionally include or exclude others. And we use our affirming language to promote the application of evidence-based and culturally informed practices. So this is the PTTC network. I'm sure everyone is quite familiar with the network. We serve the Southeast region, which is the dark blue, and we serve 8 states, and we are housed at Wake Forest School of Medicine under the direction of Doctors Kimberly Wagner and Mark Wolfson. So while you're coming in today, please do share your name. Let us know where you're from and what agency you work with. And let us know something you'd like to take away from today's webinar, because our presenters are going to be checking that out. And we want to make sure, if at all possible, we can align the information that we're sharing and the conversations that we have to meet your needs. So do share your name, where you're from, your agency, and what you'd like to take away from today's webinar. So as I said at the very beginning, this is part 2 of a 3-part series. Part 1, why alcohol policy, why it even matters to work on alcohol policy. That webinar is available on our website. It's available on our website, I believe, and it certainly is available on our YouTube page. So you can go to YouTube and search Southeast PTTC and you'll see all of our webinars. Today, we're talking about the what. We're going to talk about evidence-based alcohol policies that can help reduce community-level harms. We'll talk about different sorts of policies and where you can find more information on them. And then finally, part 3 of the series is on December 8th, and that's where we're going to talk about the how. And Michael's going to be sharing a proven and practical model, his 10-step policy adoption model that can guide you and your local coalition members and other partners to the development of local alcohol policies. So don't miss that on December 8th. Registration is still open. So these are our presenters today. We are in partnership today. The Southeast PTTC is with the Center for Advancing Alcohol Science to Practice, also known as the Center. and the U.S. Alcohol Policy Alliance. So first, I'd like to introduce Elizabeth Parsons. She is the Associate Director at the Center for Advancing Alcohol Science to Practice. She has a Master's of Education from the University of Bristol in the UK. Liz has worked in the youth and community health field for over 20 years, specializing in youth substance use prevention for the last 14. She's led local youth substance use prevention initiatives in several communities in Massachusetts, and she was a leader in the public health response to Massachusetts' review of alcohol laws. Liz has presented about local and state alcohol policy implementation at local and national forums. She especially enjoys supporting public health professionals in their efforts to increase awareness and knowledge about impactful alcohol policies and connecting alcohol policy research with practitioner efforts in communities. You're also going to hear from Snigdha Pedireddy. She is a fellow supporting the Center for Advancing Alcohol Science to Practice and the APHA's Alcohol Action Network. She is currently a PhD student at Emory University Rollins School of Public Health. Snigdha also holds an MPH in Health Behavior from the University of North Carolina at Chapel Hill and a BS in Neuroscience from Duke. She's an early career alcohol and other drug policy researcher with expertise in policy evaluation. And broadly, Snigdha studies the impacts of structural determinants on inequities and substance use related harms. And finally, to wrap up our distinguished panel, we had Michael Sparks. He's also the president of Sparks Initiatives. He's an alcohol policy specialist and co-chair for the U.S. Alcohol Policy Alliance Advisory Board. U.S. Alcohol Policy Alliance, also known as USAPA, if you hear that today. His primary interest is working with communities to serve policy to reduce alcohol-related problems. Michael currently serves as a consultant and trainer to communities across the country and is a trainer for the Community Anti-Drug Coalitions of America. He also works in a consulting role very closely with us here at Wake Forest University and also Johns Hopkins University on alcohol policy issues. He has expertise in the alcohol policy field, as well as in the areas of community building, using local control strategies to manage problematic alcohol and drug environments, the legislative process, and neighborhood revitalization. So, those are our panelists today, and I'm going to hand it over to Liz. I believe you're going to kick it off.
Hey, thank you, Kristen. Can everybody hear me okay? Excellent. Well, good morning for some of you, good afternoon for others. It's so nice to be here once again with my amazing colleagues. And I just also wanted to do another quick introduction. Our Center for Advancing Alcohol Science to Practice Director, Sarah Cooley-Brochart, is also joining us today. She has literally just returned from maternity leave. And Sarah, did you want to say something? You're raising your hand, or are you just saying hi? You're just saying hi. We are so happy and grateful that she's back, and she will be listening in and attending and perhaps available for any Q&A at the end as well. But just wanted to make sure that everyone was introduced to Sarah as well. So some information about the center. We are a new training and technical assistance center where our mission is to build the capacity of communities to use alcohol science for healthy, safe, and equitable neighborhoods through evidence-based population level strategies. And we would be happy to help anyone here to help identify gaps and strengths, provide resources, or connect you with experts in the field. Some of you who were on the last webinar had heard a little bit from us, and we'll share some more information at the end of this webinar as well about how to get in touch with us. So as a reminder, I just want to sort of set the stage and define excessive drinking. Now, I know this slide is specifically to binge drinking, but just so we're all on the same page, excessive drinking is defined as heavy drinking, which is 8 drinks a week for women, or 8 drinks or more a week for women, or 15 or more drinks a week for men. The definition of excessive drinking also includes underage drinking, any drinking by pregnant people, and it includes binge drinking, which is defined as 4 or more drinks on one occasion for women or 5 or more drinks on one occasion for men. And of the different types of excessive drinking, binge drinking is the most common, and it's also associated with the most harm. So 42% of deaths are due to excessive drinking. 42% of deaths attributed to excessive drinking are a result of binge drinking, and they make up 77% of the economic costs. Another reason why we emphasize preventing excessive drinking is because alcohol contributes to harm to people other than the person who's doing the drinking. And these harms are laid out here. Some of them may be very familiar to you in your communities, your families, or your states. But these harms include physical, sexual, and psychological violence, harms to fetuses from drinking by pregnant people, crashes involving other drivers, property crimes, financial harms, child neglect and maltreatment, social disorganization, and earlier age of initiation by youth, and increasing the frequency among youth in the same household. All right, nobody told you you're going to get a quiz. That's why it's called a pop quiz, right? So in the chat, we'd love to hear from you if you were in the first webinar, and even if you weren't, to answer these questions in the chat, and if you could put them in the same chat message. So first, who does the population level approach aim to reach, and what does it seek to change? So if you write in the same chat message, who does it aim to reach, and then maybe a comma or a space, and what does it seek to change? We'd love to hear your thoughts, or see if you remembered. Oops, sorry.
All right, I'm not seeing any responses. Come on, we've got a lot of really smart people on today. The population level approach versus an individual level approach to prevention. Who does it aim to reach? And what does it seek to change? Does it seek to change an individual's approach to substances? Chris says all the people in the community, and it seeks to change community norms. Natasha says it seeks to reach everyone and change norms. Perception.
Great.
Alexis. Yep. I just lost
Thank you.
Alexis.
Yeah, they're coming in fast now. I can't
They
keep
are
up.
hot and fast.
Yeah, we got some great answers here. So I think a lot of people got this right on. The population level approach, it addresses social, physical, and the public environment, which we'll talk about in a second. It views problems as a collective reflection of community norms and practices. So those sort of, what are those local conditions that contribute to the problem? It reaches everybody. A lot of people said everybody, population level, and it reaches policymakers and others with authority, those with political will. And it also seeks to change physical, legal, economic, and the social processes. So well done, everybody, on the quiz. So to help explain what's happening in those environments that we just mentioned, when it comes to alcohol, it's important to look at what we call the 4 Ps. Last time we talked about how the environment is impacted by alcohol access and availability, and we often describe these elements as the 4 Ps, which are product, place, price, and promotion. So for product, what type of alcohol products are in the community? Are there high alcohol concentration? Do they have high alcohol concentration? Is there a product that has alcohol and caffeine that could be particularly dangerous? Are there, and where is alcohol sold? How many outlets are in a certain area? Are they near a school or a playground, a sporting facility? The price, how are different products priced? How affordable is it, especially when thinking about youth access? And promotion, how and where are the products advertised? Where can they be displayed in your community? So I'd like you to keep these 4 Ps in mind as we discuss the 3 environments where we interact with alcohol. So the first environment is a social environment. So this is where alcohol might appear in homes, outdoors, at beaches. I know here in New England, where I am, in the woods, in cars, and parking lots is where we see some of these environments. And it could also be organizational, institutional places like service clubs or brew crew running clubs, moms groups, parent-teacher organizations. These are the places of the 4Ps, but the other Ps might also be relevant in these situations or local conditions. So for example, the types of alcohol products that are available at a brew crew running club might be different than the types of products that you might see at a mom's group or a gathering. So the other context is public environments. And it's another example of place, but also includes some of the other Ps. So community events like holiday festivals, town days, homecoming, public spaces like beaches and parks as well, and areas that may not see a lot of people, like empty parking lots or cemeteries, which is true in my area. Social and public environment examples might overlap, but the policy interventions that address the local condition that's occurring in that setting could be different. And Michael will go into that a little bit more later. But both the social and the public environments might also see different products being used as well. Price may vary. So if you think about, the price of alcohol at a public community event versus what a young person might pay, or if they pay anything, at a party in the woods or at the beach. And the last environment I'll talk about is the retail environment. And I know there's some people in the chat had put in questions and they're hoping to learn a little bit more about this. And the 4Ps are very prevalent in the retail environment. So it's, asking the questions, what do our communities look like in terms of where alcohol is sold? How many and where are the liquor stores? Can alcohol be sold in pharmacies, in convenience stores? Is it available through drive-through restaurants or fast food chains? Is there an entertainment district that clusters several alcohol licenses in one area? Are there retailers near schools or other youth-oriented spaces? And then what types of products are being sold? What do advertisements look like in store windows? And can there be discounted sales? So we can see all the 4Ps in this example. All right, we want to hear from you again in the chat. So we'd love for you to share an example of a problem related to alcohol that exists in one of those 3 environmental settings in your area. So let us know what the conditions are like and the examples of problems that exist in your community related to these environmental settings.
Somebody already posted one around a running club in town that has a bar hop. The hashtag runs with alcohol. So, again, the example of a public event that's taking place that is linked to alcohol.
Those parents drinking in the parking lot before their kids' football game. Yeah, that homecoming example I gave was one I had seen locally.
The problem with to-go margaritas, you can't be sure that underage people don't get the alcohol. A liquor store that can sell beer, wine, and liquor within a school zone.
Great.
The mommy wine culture, so socially.
Yeah.
Mm-hmm.
All right, you guys know exactly what we're talking about. All right, so before we move on, I have one last slide to sort of transition us to the next piece. So given these environments, what can you do? And in a moment, we're going to be talking about that. And we'll be talking about the science and the research behind how we know what can be impactful. But I just want to remind everyone that the strategies that reduce the availability and affordability of alcohol are associated with reducing all of these harms. So overall, in excessive drinking, motor vehicle crashes, violence, sexually transmitted infections, and chronic disease incidents. So these strategies that we'll be talking about today are associated with these reductions. And I know for many of you, that's exactly why you're on this webinar. So with that, we're going to get into effective population level strategies, and I'm going to turn it over to Michael and Snigdha to help explain where that science comes from.
Oh yeah, thanks, Liz. It was really gratifying to see so many people begin to identify local conditions based on those different kinds of environments, from public spaces to social spaces like homes to retail environment. And I think one of the big challenges for all of us working in communities is, well, how do we know what works? I've got this situation that's occurring in my town or in my county or my community. And, our coalition's identified it as something we want to address. How do we know which of the population level evidence-based interventions we should be using to really address this? And we'll talk a little bit about the big picture of what the evidence shows, and then we'll talk about some of the translation of that in terms of how you translate those strategies into local level kinds of policy. And there are some places we can go to get answers to that question. There's a lot of information out there about what works, what doesn't work. These three that you see on this slide are important resources for us. The place that I usually start is the community guide. And the community guide is a very important, it's by the Community Prevention Services Task Force. It is a thorough, deep, systematic review of the evidence on a variety of strategies, and we'll talk a little bit more about what those are in the slides that are coming. And it's my starting place. I go there first, I look at it, I read the science behind it, and I really get a sense of, okay, this is what that strategy looks like. Here's the level of support that it has. And I know I can trust that it's been sort of vetted through the research and the science to basically the intervention produce the kinds of outcomes that we'd like to see. Another really important guide here is Alcohol No Ordinary Commodity, often called ANOC. The version you see in front of you is the second edition, and the third edition will be out in November, and the third edition will have a free e-version that you can download. And once that link is available, you'll certainly be able to get it through the center. ANOC is a very comprehensive review, and the most current version will have a comprehensive review of all of the different kinds of evidence-based population level interventions and what their level of science is in terms of their strength. And are they effective? Are they not effective? And that becomes, for me, the place I go after I look at the community guide. I go into ANOC and I find out I am really interested in trying to do something around alcohol outlet density. What's the literature say? What's the strength of different kinds of intervention related to density? And I get some answers. So that translation between what these compendiums say and how we do it in our community is another step we have to take, but at least we get into the right ballpark, into the right container of what the evidence suggests works. So I start with the community guide, I move on to ANOC. The World Health Organization has a lot of European information on European and other countries' evidence-based interventions. They have what's called the SAFER initiative. What's interesting about the WHO's recommendations is they tie very closely to what we see in the US as well. So between the community guide, ANOC, and the World Health Organization, we have good evidence and good science on what we can do to address some of the kinds of issues that Liz raised in the sort of overview of the problems that are occurring both at the individual level and in terms of the harms that occur to our communities. So with that, I'll turn it over to Snigdha on the next slide.
Thank you, Michael. So we're going to start again by discussing the strategies in the community guide, which again are these evidence-based population level strategies to reduce excessive drinking as selected by the Community Preventive Services Task Force, which is an independent, non-federal panel of public health and prevention experts. And we'll zoom in on these strategies on the next slide. So the strategies with the green circles next to them are recommended as being most effective in reducing excessive drinking based on strong scientific evidence. We'll provide more detail about some of these over the next few slides, but just briefly, the recommended strategies include dram shop liability or commercial host liability, electronic screening and brief intervention approaches, enhanced enforcement of laws prohibiting sales to minors, increasing alcohol taxes, maintaining limits on days and hours of sale, and regulating alcohol outlet density. And as you can see, the privatization of retail sales is recommended against. That's the strategy with the red triangle. It's recommended against based on the evidence, and there's also insufficient evidence one way or the other to determine whether over-service initiatives or responsible beverage service training are effective. So here are some of the top strategies found in the latest compendium of effective strategies in the third edition of ANOC, the third edition that Michael just referenced. You'll notice that many are reflected in the community guide that we just covered, as well as in the WHO safer strategies. And the strategies fall under these broader categories that are bolded. And under pricing and taxation policies, we have increasing alcohol taxes and instituting minimum unit pricing by beverage. Under regulating the physical availability of alcohol, we have limiting hours and days of sale, restricting alcohol outlet density, public welfare-oriented alcohol monopolies, and establishing minimum age of purchase laws. In the third edition, the strategies are categorized by degree of effectiveness, but for our purposes, we include best and good practices, but everything on the slide has some level of effectiveness, and on the slide, the next slide as well. And we also want to note that drink driving countermeasures also have several effective examples in ANOC. We won't discuss them today, but we understand that some states are looking at lower BAC limits as a drink driving countermeasure to reduce harms. We won't cover that in detail in this presentation, but just acknowledging that that is discussed in this newest edition of ANOC. ANOC also recommends modifying the drinking context through enhanced enforcement and commercial host liability laws as effective ways to prevent excessive drinking. And one note about staff management training to manage aggression, it's completely distinct from responsible beverage service training and involves training and sometimes licensing personnel to prevent and intervene on violence in on-premise settings or bars and restaurants. And the compendium also discusses the impact of alcohol marketing on drinking behaviors, showing that both complete and partial bans are effective in reducing excessive drinking. So next, we will look at some state-level policy strategies that can be applied in local-level practice. I'll cover the state-level policy strategies and then hand it back over to Michael, who will then take us into conversations about local context. So as we've said previously, increases in alcohol availability are linked to increased alcohol consumption and subsequent increases in public health and public safety issues, especially acute problems like motor vehicle crashes, violence, etc. One way to address physical availability of alcohol is to regulate alcohol outlet density, which is the concentration of retail alcohol outlets, both on-premise and off-premise outlets within a specified area. And there's a lot of evidence showing that density is associated with consumption and harms. And I'll also add that there's a robust association between a history of redlining and segregation and the concentration of off-premise outlets or bottle shops and liquor stores in predominantly Black and brown neighborhoods. So regulating alcohol outlet density is absolutely a health equity issue. Examples of regulating density include monitoring the number of new liquor licenses granted in neighborhoods that already have a very high concentration of outlets, and working with local leaders to encourage safe and healthy operational standards for outlets. However, local communities may or may not have the authority to address outlet density through zoning or licensing controls due to state preemption. And again, Michael, we'll get into that in a few minutes. Increasing the price of alcohol through increasing alcohol taxes has shown strong and consistent evidence of effectiveness. And for those of you working in underage drinking prevention, increasing taxes have been shown to reduce youth drinking, partly through the effects on adult drinking. And it's also important to note that taxes can be more impactful to other groups because in addition to increasing the price of alcohol, which again reduces excessive drinking, taxes can also be a source of revenue for groups disproportionately impacted by excessive drinking. For example, tax revenue could be earmarked for popular social programs, enforcement efforts, or addressing social determinants of health. National and also state level analyses have shown that it's actually the non-drinkers who end up taking on the brunt of the costs of excessive drinking, and increasing alcohol taxes is a way to reduce that differential. And the Center for Alcohol Marketing to Youth created a tax calculator to help show how taxes can be helpful and address common misperceptions about taxes. This, I think someone can put a link to the calculator, the CAMI calculator in the chat if possible. But I'll add this point from the CAMI website. Overall, alcohol tax increases generally result in small increases in employment, even after taking into account the potential effect of tax increases on jobs that are specifically related to the production or sale of alcohol. And in addition to increasing alcohol taxes, price can also be impacted by avoiding promotions like happy hours or drink discounts and coupons. The next evidence-based strategy is the enforcement of laws prohibiting sales to minors. Increased enforcement has been shown to encourage compliance to minimum purchasing age and drinking age laws. And there are a few important components of an enhanced enforcement campaign, in addition to things like retailer compliance checks. The goal of these campaigns is to increase the perceived risk of detection to improve compliance. So campaigns can include a media component to publicize the increased enforcement efforts, and can also include sending letters to local establishments to inform them of enhanced enforcement activities and caution them against selling alcohol to minors. Overall, enforcement campaigns are usually a part of broader community-based intervention to address underage or excessive drinking so that communities can reduce the probability that minors get alcohol from sources other than retailers if they feel like purchasing from a retailer is risky. Dram shop liability is also called commercial host liability, and these laws hold retailers accountable when a third party is injured or harmed by a patron to whom the retailer illegally served or sold alcohol because the patron was visibly intoxicated or underage. And research shows that such laws increase retailers' perception of risk and thus increase the likelihood that they will implement preventive strategies to reduce illegal service. And implementing these preventive strategies reduces excessive drinking, which in turn reduces associated harms like motor vehicle crashes and alcohol-related violence. We know that exposure to alcohol marketing increases the attractiveness of alcohol and the likelihood of drinking by young people. And there are several forms of alcohol marketing, including in print media, TV, radio, billboards, and social media, in-store displays, alcohol use in movies, and ownership of alcohol promotional items or sponsorship at events by the industry. And in addition to increasing alcohol consumption among youth, Exposure to alcohol images and messages can precipitate craving and relapse in persons with a history of alcohol dependence. But restrictions on marketing, either through total or partial bans on marketing, are likely to deter youth from the early onset of drinking and binge drinking. This is an important point to leave you all with. Modifying the drinking context, for example, in bars and restaurants, involves implementing prevention measures that seek to redefine the contexts or change the environments where alcohol is typically sold and consumed, and has been shown to reduce alcohol-related aggression and intoxication. In showing this graphic, we're showing where different approaches to prevention sit based on how many people they can reach or affect. At the top are more individual approaches like counseling and SBIRT, which stands for screening, brief intervention, and referral to treatment. And these approaches at the top affect a smaller portion of the population and at a smaller scale. But as we work our way to the bottom, we see strategies that will affect more and more of the population. Of course, at the very bottom are the social determinants of health, which, if changed, would have the largest impact on public health in the context of reducing alcohol-related harms. And this includes reducing poverty, increasing education and employment opportunities, and improving human rights. But just above that are the evidence-based population level strategies that we've been talking about. And they all affect the environment in which we interact with alcohol, like increasing alcohol excise taxes, reducing alcohol outlets and marketing, and removing dangerous products like alcoholic energy drinks or AEDs from store shelves. And also, as we get closer to the bottom of the pyramid and at the highlighted segment of the pyramid, you'll notice either from this graphic or from experience that these efforts can take the most political will and often takes more time. And yes, pursuing these systems level and community level changes is hard work and can be really time intensive, but it's also the most impactful in terms of reducing excessive drinking and improving the public health. So now I'm going to turn it back over to Michael, who will talk specifically about how these strategies can be applied to your local community context.
Yeah, thanks, Signa. I also want to say that in addition to the power that the interventions in that on the triangle just up from the social determinants are also the most fun to do. You know, working on these kinds of strategies may not be something that we've done a lot of, but the process of moving these evidence-based sort of systems-focused interventions gives you tremendous satisfaction. They're almost like campaign-like. And again, we will be touching on some of that process in the next webinar. So one of the interesting challenges in translating the kinds of interventions that Snigdha discussed into, hopefully that background noise isn't too loud. My grandbaby's apparently unhappy. Into the actual, what do we do in our local community, bumps up against this thing called preemption. And preemption is a judicial concept that basically looks at the relationship between higher levels and lower levels of government. And what that translates to in our community, in our work, is we may be interested in implementing an ordinance to reduce alcohol outlet density, only to find out that the state has jurisdiction and authority over outlet density in the communities at the county and at the municipal level. And this is really a result of when we moved from prohibition into a state regulated regulatory systems. Each state had their own authority to create a balance between state and local authority to address alcohol related problems, or the sale of alcohol and the use of alcohol in some cases, sale and distribution and where it can be sold. So each state will have its own balance between state authority and local authority, and that makes it very important for us to understand what we can do at the local level versus what is actually preempted and must be addressed at the state level through state policy. Next slide, please. Do I have the ability to, there we go, thank you. So this is just a small example. This is the Southeast PTTC's states in their region. And we picked a number of indicators here: alcohol retail monitoring, tax sales, days and hours, social host, and looked at where there exists local authority. So where you see an X, you see some local authority to address, for example, alcohol retail monitoring, which includes looking at density and regulation of new outlets and so on. Also, days and hours of sale, some authority to look at that exists in Florida. So you can see how different states allow different kinds of local powers to address these kinds of major problems that you're experiencing, or these categories of problems that you're experiencing here. The test for us when we're in our own state, working in our own community, is really beginning to understand, where do we have authority to act locally? Are there other examples of communities across the state who may have done a particular intervention that you're looking to consider? And if so, what did it look like? Is it consistent with what you're interested in doing? And never, there's a very important premise in looking at preemption. And that is, on first blush, you may be advised that you can't do a particular local intervention. Someone may say, well, you really can't regulate alcohol outlet density at the local level in some particular state. And, perhaps your city attorney tells you that, perhaps your EBC might tell you that. They may say that that area is really restricted and the activities all have to happen at the state level. But in fact, generally speaking, we always can find some crack in preemption. We can find a way through. We may not be able to do everything that the strategy suggests, but we can do elements of what's associated with that particular intervention. So the takeaway from this notion about preemption is, yes, it exists. It's important you understand it at the local level, and there are often ways to work around state preemption to address some components of local action. Also, I want to note here that the CDC will be releasing soon state fact sheets with detailed policy surveillance on these and other indicators in the coming months. And when those come out, the center, Sarah and Liz, can certainly make those available to you, and you can request those indicators and those fact sheets through them. So next slide, please. So translating what Snigdha talked about into local action is an art at some level, because there may be issues associated with preemption. The local conditions you have may be different than the exact problem that the research is predicated on. So part of our work here is thinking about, one, how do we implement a intervention that as closely as possible replicates what the science says works? How do we do it with fidelity? How do we do it as comprehensively as possible? And how do we ensure that it will actually be implemented once it's put into place and once it's adopted? So there's a critical element here associated with these local interventions that's also important to point out, and that is the practice. The work that we do in communities often is out in front of what the research suggests may work or may not work, for that matter. So we're experimenting. In many respects, the research follows the work that's going on in local communities. And we'll talk a little bit about some places where there isn't adequate research or there's mixed evidence on effectiveness. But some of the interventions, while there may be mixed evidence, is ground in some of the principles that are associated with the best practice and what the research suggests. So next slide, please. So when we talk about price, we're really talking about decreasing the affordability of alcohol, or decreasing the affordability, increasing the price. And there's some ways that this plays out at the local level. Oftentimes we're seeing that there's heavy consumption occurring at happy hours. And in many communities, those happy hours are going from 1 hour to 2 hours to 3 hours. So we get discounted drinks, prices are cheaper, and we see levels of intoxication and resulting harms from those drinking episodes during that window. So communities are looking at, maybe we should stop those, or maybe we should decrease the hours, or do something related to that, because that's one of those core elements of reducing the price increases then the consumption. So what can we do? And do we have strong evidence to show that working just on happy hours is going to dramatically change rates of consumption and rates of problems in the community? Perhaps not, but we know that we can reduce some. And so and it's consistent with the principle of decreasing affordability and increasing price. So happy hours may be an area at the local level where you want to work. Eliminating bulk discounts. We've seen bars move from just serving, we're having pitchers at dramatically reduced price per ounce to, drinks only by the glass. So we've seen bulk discounts being put into place as a way to reduce the overconsumption may happen in on-premise establishments. Establishing or raising licensing fees. So the premise here is that if you raise licensing fees or the cost of doing business, that will translate into increasing the price of the products in order to make their, whatever profit level they're trying to establish. So, and those licensing fees or those use permit fees or different ways of doing it can then be put into enforcement, prevention, and other kinds of strategies that supplement and complement the intervention itself that you're working on in terms of raising the price of alcohol. And minimum unit pricing. For any folks who are at Alcohol Policy 19, you may have heard that Scotland and some other locations have worked on setting a baseline price for how cheaply alcohol can be sold. And I think that's something we'll be looking at the state level increasingly with increased frequency. And even at the local level, I know some communities are looking at it to see if they can do something in that regard. Next slide. So in the chat box, again, what have you seen in your own community that have attempted to raise the price of alcohol in some form? What strategies have been put in place? What are folks doing? What do you want to do that maybe you haven't gotten a chance to do yet? Just give us a couple of examples. I will note that in Alaska, we were talking yesterday about strategies that were going on in Alaska. They have essentially banned happy hours, and they banned them because of for the reasons I talked about earlier. So, there are localities who have done that and states who have done that. More likely, we'll see bans on happy hours at the local level.
So Chris says says that the state coalition in Iowa is working on minimum unit pricing.
It'll be very important for us to keep up with how you're doing, Chris. That's going to be good for other states to observe what it takes to get that passed. Anybody else working on happy hours, eliminating pitchers, some beer for sale, anything along those lines that would push the price up? Perhaps increasing licensing fees if you have that authority at the local level, or requiring conditional use permits to open a alcohol establishment, of which there's a fee associated with the permitting process that could be paid every year, increasing business license fees as opposed to alcohol licensing per se. Anybody seeing work going on in the state? Massachusetts have kept their happy hour ban. Good, that's great. So I want to point out, as Snigdha mentioned, that increasing the price of alcohol is one of the areas where we have some of our strongest evidence. And so, actually doing a tax increase may not be permitted at the local level. Perhaps a minimum pricing might be, this is what we're looking at, but turn your attention to that could be one of the areas where we have to get some real traction in terms of change of problems rates. All right, next slide, please. So looking at reducing the physical availability of alcohol, this is a big one. We have very strong evidence on the reduced harms that come from reducing alcohol outlet density, number, types, locations, clustering. There's lots of ways that reducing density ways it can look. It can be creating spacing distance between outlets of different types, of similar types. It can be in relationship to its proximity to schools or parks or other sensitive land uses. Lots of ways we can focus on that, and that is an area that can yield some pretty significant benefits in terms of a variety of harms, both at the individual and community level. We can also talk about bans, looking at not allowing underage patrons in bars. In my own community in California, before I moved to Hawaii, we had a big fight about the fact that a pool hall, which was really a club, was trying to create a room that was literally adjacent to the place, but it was supposed to be separate, where people 18 and above can go and hang out and have social time. It was like, you've got to be kidding. Aside from all the implications of what that looks like and the sort of messaging it sends to young people, the ability to stop the sale of alcohol to those folks was going to be very, very problematic. But this is what we're seeing, is increasingly trying to open up spaces that have been traditionally relegated to 21 and older to younger people. We sometimes see young people can go into bars if they're accompanied by adults. In restaurants that have bars, Applebee's and other places, for example, we've seen that they allow in some states young people to sit at the bar with their parent as long as they're not drinking. So we look at bans. And looking at the hours and days of sale, this is a really important piece. We're increasingly seeing pushes to expand the sale of alcohol, the hours of sale. Good example is the California 4 a.m. bar bill that comes up every 2 or 3 years that the CAPA, the State Alliance, has to work on to defeat time and time and time again. We've seen other states expand their hours. We saw some expansion of hours for sale of alcohol during the pandemic that was supposed to be in emergency proclamations that then were codified. I want to point out that while we may be looking at working on these local strategies on a proactive basis, seeing a condition we want to address and beginning to think about how to address it, oftentimes we're working on a defensive place too, where we're trying to prevent the repeal of good alcohol policies, like expanding the hours of sale. Next slide, please. So who's working on reducing alcohol density in some form? Who's working on days of hours of sale? Who is really looking at changing the physical availability of alcohol in their community?
Well, I will say Marianne said with regards to Phoenix and Arizona, they haven't really seen anything going on there. She thinks businesses want the tourism, so it doesn't seem to be a concern.
Yeah, these can be difficult. I'll share an example of an area where I live. I also live in a tourist area, and we have in my town, PA, for any of you who have been there, an area called the Triangle. This is a very small geographic area. I mean, very small, half a block, quarter of a block. And in that triangle, there are 14 bars, 14 places that sell alcohol. And they had a couple of shootings there a few years ago. And when the government was the state government, the county government rather, was trying to figure out what do we do about this? We're having violence show up at these places. I sent in testimony saying, well, here are some of the strategies that we have science on. And I said, oh, no. We don't want to reduce the number of outlets. This is, we want to contain, we want to put more bars in places where we can control it. And it was like, well, you're not controlling it. There's, gun violence is just one example of the kinds of problems that occur there. And instead, what their solution was, they were going to stop allowing people to hold drinks while they danced. That was going to be their solution. So that's what they did. No changes in the hours, no changes in the number of outlets, no bans on putting more outlets in that confined space. So again, we're often playing defense around these conditions, as you were talking about in Arizona.
So Kathy did say that the Youth Coalition is working on getting signs up in the parks to remind people that drinking at parks is prohibited, because currently there's no sort of an compliance going on, no measures going on.
Okay. So again, what we're talking about here is translating the science that's in the community guide, the science that's alcohol, no ordinary commodity, the science in the world, into strategies and interventions that we can use at the local level, which attempt to do what the evidence shows is effective. Right, let's move on to the next slide. So alcohol advertising and promotions. This is a increasing area that we're seeing alcohol, the alcohol industry putting energy into. And there's lots of ways that we see ads. I mean, they're everywhere around us. As someone said recently, they're the wallpaper of our community. We see them on the outsides of outlets. We see them on the insides of outlets. We see beer, stacks of cases of beer when you walk into pharmacies or into grocery stores. We see them on billboards. We see them on public transportation. We see them everywhere. And part of what we're attempting to do here is decrease the amount of pro-alcohol promotions that are going on all around us. We certainly see them in social media. So part of our goal here is to address this. And there's challenges around working on marketing and promotions, but there's opportunities, and communities have different levels of opportunities to do this. We've seen some communities ban alcohol advertising on the outsides of convenience stores, for example. We've seen them restrict where advertising can occur inside stores. We've seen billboard bans. We've seen restriction on public transportation. So there are ways to do this. It's unlikely that you're going to eliminate all alcohol, advertising in a community. And we're going to struggle with the social marketing piece where young people now are being targeted and marketed directly through Facebook and Instagram and other social media platforms. But we need to make a run at this. And so the importance of focusing on this and getting the temperature of the community to address it, I think, is going to be increasingly important for us. There is new evidence showing that, strong evidence showing that the amount of advertising young people are exposed to increases their consumption and decreases their age of initiation. So we have a lot at stake in beginning to address this. So at the local level, I want to point out that just raising the awareness of the fact of the impact of advertising to the community can lead to some pretty significant kinds of changes. Even something as simple as, in one case, a Little League team, wanted to, the board of directors wanted to allow bars to put up their signs around the outside, the fence that runs around the outfield. And it was a big debate in that Little League. Do we really want more alcohol advertising where our young people are gathering? And ultimately, they decided not to do it. Is that going to reduce rates of problems? No, but what it did do is it raised the attention level of the community on advertising, and they began to then look at and explore ways to begin to limit it in other venues as well. So next slide, please. Anybody working on marketing and promotion in your communities? Anybody doing anything here? Okay. If anything comes up as we continue to move through this, it may not be available to you right now. Just feel free to drop in the chat box. Maine has limits on the number of signs outside and inside the establishments. That's awesome. That's great. It'd be really interesting what that limit is. But yeah, that's great. We can do those kinds of things state by state by state and in local communities. Right, next slide. Going to move this up a little bit, kind of speed through this. Enforcement's an important part of our work. Sales to minors, sales to intoxicated patrons in on-premise establishments, drinking and driving. We have interventions that can work towards reducing problems. We have a good sense of strategies that can work to begin to reduce drinking and driving. We understand that there are strategies that can begin to address the over-service that's put into place, bar checks by law enforcement coming in. Doing consistent sales to minors compliance checks can be very, very important, particularly when they're done regularly. And we have good evidence that's come out of the University of Minnesota and what that looks like, how often you have to do it, how they can be conducted. If they can't be conducted by your state ABC, you can run checks using minors or adults, 21-year-olds who look like they're underage. There's no force of law, but it can raise awareness about the fact that there are sales to minors going on. Party patrols, party dispersal, we don't have strong evidence on, but they are being used in communities. Those particular strategies are most useful when they're coupled in a comprehensive approach, and we'll talk a little bit more about that in the next set of interventions, things like social host. But we do have some really innovative things going on, particularly in the area of looking at place of last drink. There's work right now in the University of Minnesota, Tracy Toomey's shop, looking at the ways, collecting information and how those place of last drink data can be used then to reduce drinking and driving and other related problems. So next slide. Is anyone using Chat, again, anyone using enforcement strategies that you've seen, that you're interested in, that you're thinking about, that you've seen be effective. Party patrols. And Bree, are your party patrols, what effect are your party patrols having from just your perspective? What are you seeing happening as a result of those? Is it in some way reducing the number of home parties? How's that look? So anything you could put in the chat box would be helpful. All right, let's move on to the next slide so I can get through this and make room for the remainder of the work. Modifying the drinking context. So in this particular set of interventions here, it's important to point out that there's really mixed evidence, particularly on responsible beverage service. The community guide speaks to that as one of their strategies. And yet we know that many communities work on responsible beverage service. It's seen as, and in some compendiums that are put out by different states, it's listed as an evidence-based intervention. And there are clearly ways in which RBS, let's just talk about that one for a moment, can be more effective than other ways. If it's done by ordinance, for example, all outlets on premise, off premise have to be trained in the community. People who are new clerks have to be trained within a specific period of time. The training has to be a certified curriculum that includes both information and skills building. It's coupled with ongoing enforcement so that there's deterrence. It's done on a regular basis so we don't have a decaying effect. So there's ways in which RBS can be stronger. But what we're pretty clear on is voluntary RBS done to a few businesses in the community does not work. Or it may work for a very short period of time. It may raise awareness of the fact that there's a problem, and people may begin to adopt different policies in terms of their sales or service, but it decays very quickly, and if it's not followed up on, it's pretty much lost. It's almost an educational program at that point if it's not made mandatory. So just be thinking about, and you can touch base with the center if you want some of the research on what's best practice around RBS from the standpoint of making it as strong as possible. Criminal civil social host ordinances are another very popular intervention that are being done across the country, and they're complicated. So I don't want to spend a lot of time here, but what we do see happening in communities is that they're passing many local, what we call civil social host ordinances that are designed to hold adult hosts of parties accountable for the party, as opposed to criminalizing the youth who are at them. And so there's some evidence beginning to come out now that's showing some impacts. There was a national study, community trial on this, and the results of that are forthcoming out of Wake Forest. Shoulder tap restrictions, so we don't have much evidence on this, but shoulder tap restrictions, as you probably know, are when young people go up and approach an adult outside of a store and get them to go in and buy, and then they transfer the alcohol on the side of the parking lot or something along those lines, and then bans on public drinking. So I would imagine, if we go to the next slide, that there are a number of communities here working on social host ordinances, working on some form of RBS. Be interested in your chat as we move forward here, put in anything that you're working on, and we can take note of that. So as a reminder, part of our work in local communities is to really fully understand what we talked about in the first session. For those of you who are there, these things called local conditions, the manifestation of the problem and the setting in which it's occurring. So what's happening, who's doing what context, what setting is the problematic behavior occurring in? Is it happening? Is there underage drinking happening at homes? Is it out in fields? Is it at beaches? Do we have over-service problems or high levels of intoxication in on-premise establishments? Are there high rates of sales to minors? Just what's going on, and then which places, and all businesses, some businesses. Local conditions are very explicit. They really seek to understand the specific condition that's happening, where it's happening, times it's happening, who's involved, and then the interventions that I've been talking about are designed specifically to address those conditions. And that's what is the art around all of this, is making sure we understand very clearly what the local condition is, and we select an intervention that has a clear link to science, some link to science, that we do it with fidelity, as I mentioned earlier. We try and get as much done through policy as possible. Then we ensure that the policies are going to be implemented. There is a data tool that is available through the U.S. Alcohol Policy Alliance, and you certainly can request it through the center or through USAPA, that talks about how to use local data to support the identification of local conditions and the selection of interventions. So that may be helpful for you as you begin to address these conditions in your own communities. We are going to be talking in our next session, which I believe is the first. We'll get the date out here in a moment. But on how we can actually move towards implementing with some kind of model, policy model that works and has shown to be effective, the implementation of the kinds of strategies we're talking about today. And you'll see from the conversation that we had a number of key interventions discussed in the breakout. One, we had state level, working on alcohol taxes. We talked about enforcement interventions, which can happen at the local level. And we talked about some other interventions, which could be like perhaps mandatory municipal RBS training that might take place, those kinds of things. So we're going to talk about how you do that. And we're also going to encourage you between now and the next session to look at what's already on the books in your local community. What of all those categories that we discussed, and the slides will be available as a reminder for you, regulating promotion, physical availability, changing the drinking context. I'm sure there's a couple more I'm not thinking of at the moment. What do you already have happening? What's already on the books? Do you have, for example, ordinances that restrict any of the 4 Ps? Is there anything on the books that regulates where outlets can be located? That's close to schools or not close to schools. Is there anything on the books that specify advertising and whether, how much, and if it can be involved, on the exterior of businesses or on billboards or walls or whatever? Is there anything associated with regulating the products, actually moving high risk products like alcohol pops or fortified wines or those kinds of beverages, and all the emerging products that are starting to come out in specific sections of the store? Are they everywhere? And where? So we have price in terms of what's being sold, how cheap is it? Do they have price discounting? Are there happy hours? We have the promotion. We just discussed that. The whole place issue. Where's your drinking occurring? Do you have ordinances regulating home parties in some form, civil social host ordinances? What do you have on the books? And then the next question really is, if it's on the books, is it being enforced? That's because one of the major issues we see is the enforcement of existing policies. Often, let me rephrase that, at times, decision makers, city council members, county commissioners, and the like will pass ordinances without a lot of enthusiasm for actually enforcing them. And so, we need to know, are things on the books that are not being enforced, because that's a starting place in terms of moving towards implementing and carrying out policies to make a change in your community. And also, what do you know you're preempted from? What's out there that you can't do? And it'll be interesting to see if there's a crack in some of that preemption. If your city attorney or someone said, yeah, you just can't do that. You just can't do it. No way you can do it. Now, there may be a workaround. So we're giving you a little bit of homework, asking you to look at what's on your books. Is it being enforced? What preemption do you have? And at that point, come back into our next session. We'll have opportunities to discuss some of those things, and we'll be presenting a way to actually carry out policymaking process as a campaign. So next slide, please.
I can take this one. So an important piece of doing this work is staying connected with others and sharing ideas and expertise. And as we mentioned, the U.S. Alcohol Policy Alliance is a partner with the Center, as well as the APHA's, the American Public Health Association's Alcohol, Tobacco, and Other Drugs section. The project of the ATOD section is the Alcohol Action Network. And both serve as excellent resources. If you would like to get on their listservs or learn more about them, you can visit them at the website or send emails that are listed here. And Snigdha is actually the one who gets the Alcohol Action Network emails. So we'd be happy they'd be happy to include your information on their listservs if you need more information. And of course, sign up for the center's mailing list. We don't bombard you with emails. It's just pertinent, relevant information as it arrives. And also, this QR code would take you to sign up for our e-news, but also if you have any questions or a request for technical assistance, if questions have come up here that you think maybe you need to be connected with an expert or a resource, we'd be very happy to help. And along those same lines, we also work with state alcohol epidemiologists who are also CDC funded. And there are currently 12 states that have alcohol epidemiologists and sometimes teams who are looking to support statewide and local prevention work and preventing of excessive drinking. And I think we might have even have one or two on the call today. So I just wanted to tell you now who those states are who are funded and encourage you to connect with them, and feel free to do that through us. We'd be happy to get you connected if you want to fill out this form and let us know what you need. But those states are California, Oregon, Idaho, Rhode Island, New Mexico, Colorado, Texas, thank you, Sarah's putting in the chat, Minnesota, North Carolina, Alaska, Maryland. What did I miss some? But Sarah put them in the chat, I think. Let's see, Texas, New York. There we go. All right. I think that's you, Kristen.
Well, so now it's time for Q&A, and I think, Michael, you're going to facilitate that. This is the opportunity for you to ask questions, things that popped up, or things that we didn't cover that you had a question about, or plenty of things we did cover that you have a question about. This is
questions about where you can get resources or anything at all at this point. I will mention, as you're thinking about any questions you might have, that there is an upcoming 3-part interactive dialogue on the new emerging products that are making their way into stores, and there's some pretty outrageous stuff that's coming your way, coming down the tracks towards a community like yours. And if you want, right now we either at capacity or over capacity. I think we have 350 people registered for that. Not everybody comes, but please sign up. It's a 3-parter, because if you can't get in the first, you may be able to get into the second around this. And I can put a link into the chat about the availability of that. So with that shameless plug, what questions do you have in terms of this webinar or any aspect of the first two?
I'll also say SAMHSA is coming out with a new resource on implementing community level policies to prevent alcohol misuse. And on November 10th, the PTTC network is hosting a webinar from 11 to 12 p.m. Pacific time, 2 to 3 p.m. Eastern time. And you can go to the PTTC network to find out more information on that. And I'm going to put their email in the chat if you want to find out more.
Well, we've been here a while, but any questions about resources? Okay, Kristen, I'll turn it back to you.
Yeah, okay. Oh, here's one. We've got one from Kathy. How does the alcohol content of the flavored alcoholic seltzers compare to beer?
I have seen seltzers that come in at, I mean, beer now, beer goes from 3.2 in some states, but a light beer can go from 4.5 to an IPA can go up to 9%. So we have a lot of change, a lot of room in that. And I've seen seltzers come in at the lower 4s, and I've seen it, and I can't remember the brands, I'm sorry, actually go up to 6. So they're coming in close to where the beers are, particularly, and that's partly because these seltzers are being branded as a way to have low calories, less weight gain, sort of health foods, in some form. And so they're not as heavily packed with high alcohol content. We are seeing significant alcohol content boosts in the alcohol pops, 12, 13, 14%. We're seeing obviously the beers are going up. I saw a beer at a local brewery somewhere, some point in the last year that was 12%. So we're seeing a lot of bumping of the alcohol content, and those obviously creates real significant risk, particularly the flavored ones, because they're consumed quickly, they're consumed by young people. And if you have a 32-ounce alcohol pop at 12 or 13% by volume alcohol, when you drink that alcohol pop, you're drinking the equivalent of 5 beers or 5 shots of alcohol. So they're very, very risky. Great question. Thank you.
I'd like to, if I could follow up with that, is there any movement to ban flavored alcohol pops, just like we're trying to ban flavored tobacco and the flavored vapes and flavored marijuana for that matter? Obviously the flavors are the enticement for youth.
Would anybody in the group like to respond to that? Anybody have any background awareness of that? I have a little bit. There's been 2 runs at doing something about that. One was getting the caffeine removed, which we were successful. But also, what we know about these flavored beverages, these alcohol pops, is that they start with a malt base, a beer base, a malt base. They take out all the malt, and then they add distilled spirits in to be able to give them the bump in the alcohol content that they like to have. And yet they're treated as if they're beer, a malt beverage, because it puts them in a lower tax bracket, which allows them to sell it cheaper. And so as a result, the runs that we've made to the federal government to regulate these have been mostly around, let's get honest about what's in them, let's tax them appropriately, let's call them what they are, let's put warning labels on them, let's do stuff that's flavored. But there's other backdoor strategies we're trying to get at to basically make them less available and less appealing. We're it's going to be a big fight. We're having a real difficult time doing much about that at the federal level. This is partly why these sessions are really important, because when they do a call, when the feds put out a call to get, testimony on legislative actions like, removing certain products from the market or removing the, changing the composition and the regulation of alcohol pops from a beer base to a distilled spirits base, we look to the field to speak up on this. We need thousands and thousands of people. We're up against some heavy economic pressure to keep it the way it is. So please register with the center, USAPA, and others, and we will let you know when there's a call to action around things like what you just asked about, Kathy.
Michael, I believe Sarah raised her hand.
Sarah.
Hey, everybody. Yeah, great response, Michael. I just wanted to point out that's an excellent observation across the substances that you all are working on in your communities, that the flavors and appealing to youth, it's a big issue for cannabis, and as states, bring cannabis, they're trying to make sure that the products are not appealing to youth with these flavors. States are taking action with all of the great tobacco work and monies to support that tobacco work, oftentimes on flavors. So it's a really good, thing to say. And alcohol flavors, it's really been happening at an increased level, bringing in additional women and additional youth into the market at younger ages and with different types of products, as you're noticing. And, as Michael's kind of pointing out, some of the regulatory elements that we have with alcohol, the way that rules and laws are written, have their technicalities that make certain avenues ones that we can pursue there, and they may not be as open or as flavors and appealing to youth as some of these other products. But it's something great to point out as you have those conversations, because it's very readily understood by folks that you're talking to in the communities and otherwise, that flavors are indeed appealing to youth, and trying to get youth in at a younger age is something that most are concerned about. So again, just making those connections is really important to getting people to open their eyes and really see what issues are merging and what issues are becoming more kind of ingrained in the alcohol space. And I think we're seeing that. And again, pointing to the USEPA emerging trends and high risk products that's going to be coming up. I think that's a great place to kind of bring that thought into that conversation.
Yeah, thank you, Sarah, because you're right. You know, we may hit roadblocks at the federal level around regulation or at the state level, but local levels may have some room to do some work on that. And while we'd love to see a regulatory change at the federal level regarding some aspects of these products, if we can get community making enough noise about their concerns about these products and the flavor and the way they're advertised, the way the cans themselves, you know, confuse non-alcoholic from alcoholic drinks, the alcohol content in them, taxing of them, we may be able to get some local action around that. So don't give up because it's not happening federally. You know, make some noise at the local level. Sarah suggested. It's good. Okie dokie. Bring it home.
Okay, well, that is it. Thank you all for your contributions and your questions and your comments. It really makes it so much more meaningful when you engage in the webinar with us. So you're welcome, Marianne and others. Thank you so much for being on. Remember that there is session 3 on December 8th. You'll find the information at pttcnetwork.org/southeast. That's where you can go to register. When you close out, you're automatically going to be sent to our evaluation. Thank you so much for participating in the evaluation, and make sure you download and save your certificate of attendance for those of you that need it, those of you working on certification or recertification or otherwise. With that, the weekend is right around the corner, so have a very safe weekend and a happy Halloween, and we'll see you at our next event. And thank you to our wonderful speakers. The Southeast PTTC is so thankful for your input and your collaboration. So we'll be seeing you soon. Bye-bye.
Nice seeing you all. Good seeing some old friends. Take care.